Oh, there he is. Hello. Good morning. How are you?
Good morning, Nikki. I'm doing well. How are you and everybody else today?
We're doing well. My kids are sick, but that's okay. They have a respiratory illness, actually, which maybe you can help them. No, I'm just kidding. Talking about chickens today.
Yeah, that's right. We'll focus on the chickens and let the real doctors take care of the kiddos. But
right. Yeah, that's just got that summer cold,
Man, it's that time.
Yeah.
Summer colds are the worst for me anyway. It's hard to get over that. But
they are. All they want to do is swim and have fun and be outside, and we can't do that. Okay, I was just asking everybody where they were tuning in from. And so we're going to talk about respiratory illness with chickens today. And this is going to be your expertise. I haven't dealt with it too much with my flock. And anytime we do, I usually go see my poultry vet because I want to make sure I know what I'm dealing with and they have the proper medication. And I know that's not an option for everybody, but do you want to talk a little bit about what you're doing with your business so they can find out about it if they don't know?
Yeah, for sure. I probably should start off with somebody's going to be tuning in here in about an hour and waiting for us to go live, but they're going to get a recording. So apologies for that. I sent out a newsletter here earlier in the week. Maybe I've missed the time, so apologies for that. But no, really excited to share that finally what we've been working really hard for, this copper feather tier where folks can have access to basically the vet your flock tool is what we created. And so you can go in there and you can, if you've got an issue, you've got a respiratory issue going on in your flock, you can speak with it, talk to it, and tell it about, what's going on, and it'll know where you're at, the number of birds you're dealing with, and basically walk you through a series of questions kind of in a conversation style. And at the end gives you basically what it thinks it could be, things you can do at home. And then if it's serious enough, it can refer you to a consultation with us so that we can help you out there. But for the most part, we're really trying to guide people on what they can do at home. But that comes with it in addition to, there's an awesome dashboard now that we've created where you can log your individual birds, you can keep track of them. And let's say you've got an issue with one in particular and you're talking to the agent, the Vet Your Flock tool, it knows, it will know who that bird is and remember that conversation. So if you came back to it later, it can pick back up where you left off. But you can track weight. So, that's one of the big things we talk about, right? Trying to use objective data to measure or to keep track of our birds because they often hide those symptoms really well. So weight is a good one to measure, but egg production and, obviously what breed it is and variety and all these different things that we can measure in that dashboard. So that's really cool. And then obviously the content and other, the articles and all kinds of stuff that's accessible there. So go check that out. It's a copper tier. It's like $9.99 a month and gives you access to some really cool things that we've been building for what feels like forever, but we're excited to get that out. And so today is like the first day. So thanks for sharing that.
So thepoultrydoc.com.
Yep. Go to thepoultrydoc.com and go down. You'll see, actually at the top of the page now, there's a little paragraph there. And so you'll find a link to our membership there where you can find that. And then the founding feather is still there too. So different tiers. One is telemedicine, and this is more helpful, just access to that tool, access to tools that help track your flock. So
yeah. And I want everybody to know, this is not a sponsored relationship. I actually am a founding feather, but I paid for it myself because I really believe in what the Poultry Doc is doing. And I wanted to make sure that you guys had access to all of this information. There's just not a lot out there online that you can trust. Even if I Google something chicken related, I will find different answers that are completely opposite of each other. And I found this a lot researching for my new book. It was like, oh my gosh, somebody is saying something completely different. And you usually find that a lot of these are just bloggers, people with no experience, and just putting whatever out there. And then Google and, all the AI now just kind of pull from that and come up with answers for you, but they're not always accurate. So I've been playing around with your website and all this stuff you're talking about, and I've been putting my flock in there, and it's really intuitive, and I really am liking it a lot.
Yeah, well, thank you. That's awesome. I mean, obviously, you've played around. There's so much misinformation out there, and you're right. That's Google and chat. They're all aggregators of that information, which much of it is misinformation. It's not good. Mm-hmm. So what we've created is there's thousands of articles and all these different resources, and even down to the notes I took in grad school, transcripts of classes, everything that's gone into build what we call the knowledge base that provides this information. So it's not tapping Google, it's not tapping chat, it's not doing anything. It's a custom knowledge base that we've created to help you answer all those questions about your flock. So really go check it out. It's really, really awesome in what it's been able to provide. And so one, thanks to all your followers. They've been great, and you for helping us out. It's been a really good interaction with all your folks too. So thank you for that.
I have a really good following. Everybody's really respectful and nice. I'm really grateful for my comment section and all the people here. So anyway, okay, let's get into respiratory illnesses. What time of year is this most prevalent? I think that's like one question we can start with.
Yeah, for sure. So, if we look at commercial, it's usually the wintertime. Things are, it's colder. We keep the houses kind of tighter. The air quality, like environment doesn't work, is not as good, let's put it that way. But in the summertime, in the backyard flocks, we've got a lot of things going on. People are swapping birds. There's meets and shows and all these things. And they happen in the winter too, but they really happen in the summer. So we worry about more dust in the backyard environment than we worry about like ammonia, for instance. It's just not as big a deal. But the main issues that we worry about, infectious bronchitis could be one, right? A relatively mild virus that kind of goes through backyard flocks. It's not that bad. But really, Mycoplasma is the one that we want to talk about. That's the most, severe in backyard flocks, and the one that really cycles the most, right? That we find the most. And there's two there. There's Mycoplasma synoviae, or MS. You may have heard it referred to as before. Not as severe of a disease, more prevalent. And then there's Mycoplasma gallisepticum, which is definitely a more severe respiratory bacteria. And both of those are vertically transmitted. And both of them, once your flock has them, we can treat the clinical signs and help them get over that, but they will have it forever. And they will shed that in their eggs. So if you're hatching eggs, that bacteria is passed in the egg and will go on to your baby chicks. So always things to keep in mind. Infectious laryngotracheitis is another one. So ILT is the acronym for that, and another severe respiratory disease that usually is more of an issue in the wintertime, but really circulates, kind of moves through flocks all the time. And that's another one that, once they get it, they have it. Can help with the clinical signs, but we really can't treat it and make it go away. It's a virus, it's a herpes virus, right? So once they get it, it's forever.
Okay. So if you were going to bring in a new chicken to your flock, that has been on another farm or maybe hatched from another farm, like you're saying, some stuff will transfer through the hatching eggs. What are you doing when you bring them home? Are you testing them? Are you, I quarantine all of mine I do a month because
right.
I know a lot of people don't do a whole month, but I do because I know some stuff takes a while to show its ugly head. So definitely. What are you doing if you're bringing someone home?
Yeah, so, the 30-day quarantine is great. And what I tell folks, obviously implement that. That's great because you want to see those signs come up. And it's usually 4 to 5 days. So just the stress of bringing them into a new environment is often enough to trigger like the Mycoplasma or LT. If they have it, you'll see those signs develop in those first, less than a week usually. So there's this 30-day quarantine period, but it's not like the magic bullet that just, at the end of 30 days, things go away, right? The best thing to do is screen those birds before you introduce them into your flock. So use a test like PCR, for example, where we can look for Mycoplasma. We can look for LT and some of these other things. Those two are the main ones, Mycoplasma being the most, it's more prevalent, and LT is obviously there too, but a simple mouth swab, and we have a test on the website where we can look for both MS and MG in one test. And it's a simple, like I said, coinal cleft swab. You do a little mouth swab in the roof of the chicken's mouth. A chicken has a natural cleft palate. If you ever looked in your chicken's mouth, there's a slit in there. And that's actually a really easy spot where we sample for these respiratory bugs. And then you take that swab and you roll it onto a little test card, and that inactivates those any virus or bacteria there. It's temperature, or it makes it temperature stable. So it make sure that the DNA or RNA, whatever we're looking for, is stable, and actually just put it in an envelope and ship it in the mail and send it to one of the labs that we work with, and they run a PCR test and give you results back, whether it's positive or negative. So those are some of the simple things we can do, but definitely quarantine is important. And the other thing you want to do too is make sure that you go to your, the flock that you have, right? Your healthy birds, those that that are healthy, and then you go work with your birds that are coming in. So any of those birds that are in quarantine, those are always the last ones that you want to work with.
Yeah, definitely go to your healthy guys first. And I even don't share tools. I don't wear the same boots around my healthy flock or my, new flock, and, washing hands and all that kind of stuff. My husband is probably not thrilled with me all the time because my garage is my quarantine spot because I can close the door. It's far enough away from my flock and I can keep everybody separate, which means we don't get to park in the garage. So, because we're always getting new chickens at my house, we have like a permanent setup for newbies. So,
yeah. One thing too is, to mention, you mentioned tools, right? So obviously vectors of bringing in disease. Most often, the most common way these come into a flock is really on your 2 feet. Most people just pick them up. They don't realize it. They go to the farm store, right, where everybody else is there. They all, not all, but many of them have chickens too. You're walking down the chicken aisle. Obviously, those people have chickens. Yeah. And if they've got some disease, their flock has some disease, you pick it up on your feet and then you wear those same shoes in your coop. That's a great way to introduce disease. So that's, you mentioned the coop shoes. Those are some of the most important tools you can have. It sounds so simple, but just changing a pair of shoes can really help you out in the long run.
Yeah. Okay. That's good to know. So I have new chickens in my garage right now, and they've not been tested for anything. So maybe I'll get the kit from your site and then I'll show people how I do it, send it away, show them the results, and the protocol and all that kind of stuff. So maybe you and I can chat through that and I can do that for everybody.
Yeah, for sure. And one thing to mention, we're working up the lab, not just yet, we're hooking up the back end, but like we talked about the dashboard, but we're building an integration where Iowa State University is going to become our diagnostic partner. And so Iowa State it's actually, if it's not I'm pretty sure it's the largest veterinary diagnostic lab in the U.S. It's awesome. I've been there, and there's I've got some colleagues that work there, great poultry veterinarians that are going to do these tests and do necropsies and do all these things. But we'll be expanding that. So outside of just Mycoplasma, MS, and MG, we'll have LT and Coryza, which is one we need to talk about too. But in addition to a whole suite of other tests. So look forward to that coming here in the near future as we get that rolled out.
That's awesome. Okay, so let's go to a question here. Someone said, I have a young hen. She appears fine other than sneezing. Could this just resolve itself?
Yeah, that's, I get this a lot, right? So a bird comes in or somebody, asks us, hey, I see sneezing, or, I hear a little snick or maybe a little gurgle. Many of these birds will get over it themselves, right? So many people want to just jump, what antibiotic do I need? Finding something online. That's really probably not the first thing we want to run to, right? Many birds, again, will get over it. It's take a wait and see approach. Now, if you see them become lethargic, right, just not getting around as well or hiding in the corner of the coop, that's a sign that we need to kind of take it to another level in terms of care and what we need to do. So if you hear a snick, a little rattle, maybe a gurgle, take a wait and see approach. If you start to see that move through the flock, right, we start to see multiple birds and start to see maybe them not acting quite right. We talked about weight, if we can get a measure of weight. If they're losing weight, that's always a good sign that we need to intervene. But in many cases, it's just, let's take a wait and see approach before we jump straight to antibiotics.
Yeah. I see a lot of times my chickens will sneeze after a dust bath or, if they're digging around a lot, things like that. And I feel like it's probably them just clearing their sinuses, just like we would if we were around a lot of dust. But if you're seeing like continual sneezing and some discharge happening, bubbly eyes, I notice, can be a sign of respiratory illness. And then like you said, like the gurgling noise and stuff like that. But I feel like some of these things are with chickens they got kind of something stuck or they're just trying to clear things out. And it's not continual. I don't tend to worry about that stuff. Maybe I should, but I don't usually. Just kind of observe my chickens to make sure it's not going to keep on going on.
Sure. You mentioned kids, right? If I brought the kids to the doctor every time they got a sneeze, then we'd never leave. But right, just keep an eye on them. For the most part, many times they'll get over it. But you're right, if you see the bubbly eyes, right, if you see the drainage, that's getting more severe. We also see that a lot too, where chickens' eyes kind of closed up. Sometimes it's just one, and many folks will think, something happened to the eye. There was something pecked its eye. It's probably not the case. Respiratory disease in chickens really refers itself through the eye. We really find the eyes affected. Obviously, the respiratory tract is affected too, but kind of outwardly, the signs that we see are usually those gunky eyes, kind of shut, bubbles are a great one. If you see bubbles in the eye, it really points us down the path of MG, potentially LT. So those are ones we really want to look for and take a closer look at.
Carol says that her hen is similar, except she has heavy breathing. It hasn't resolved in 2 months, but she's acting fine other than the heavy breathing.
Yeah, well, there's two ways to look at that, right? It's summertime. There's panting, and we can usually tell the difference, right? Birds are going to pant in the summertime. That's how they get rid of heat. So that's going to be normal. When you see this kind of full body, like deep breathing, there could be something going on. Usually, baby chicks are more susceptible to what we call fungal pneumonia, right? So they really don't have a good immune system yet. So those fungal spores can really start to grow and affect the lungs, and that's a really serious disease. Actually, it's one that's hard to get over. As birds become a little bit older, weeks really, not that much older, they really develop an immunity to that. We rarely see it in birds that are older, unless they have some immune suppressive disease. Now, if they're older, like months, years old, and you see that really deep breathing, there's likely something else going on that we need to take a look at. Could be pneumonia, could be a air sac infection. And that's probably one we want to talk about too. Birds' lungs are completely different than ours. They actually are fixed. So if we think about our lungs as like kind of like a sac, right? We breathe in, we pull air into the lungs, and there's little air sacs, right? That not air sacs, but alveoli. So these are like little bubbles in your lung. They fill up with air, and then there's a very, very, very thin membrane where oxygen perfuses into the blood there. Birds' lungs are totally different. On inspiration, the air goes through them, completely through them, into these air sacs that extend into the abdomen. They actually go into the bones in some cases. And then on expiration, the air passes a second time back through those lungs. And so it's a evolutionary adaptation for flying, right? To pull as much oxygen as possible out of the lungs, which is really unique, but it also means that it exposes those lungs to particulates like wildfire smoke or dust multiple times over. And those air sacs that extend into the abdomen, they can be a place where some of those particulates can settle, and it's really hard for birds to clear that out of those. So we can find infections in the air sac, and those are scenarios where we would want to look at potentially an antibiotic if they're really struggling to breathe.
Somebody asked, this is not related, but do you have like a test on your website for chicken dropping testing for worms?
For fecal. Yeah, we do have a fecal. Like I'm doing them right now, so we don't talk about it too much because our time's limited. But for sure, there's a fecal, and we'll be actually Iowa's going to be doing that one for us as well too. But there is a fecal. I don't know if I have it turned on, but we can turn that one on. Like you guys submitted. It's a simple one, right? It's not necessarily a kit that we send out to you. That wouldn't make a lot of sense, but you basically send us a bag of droppings, and the way we want to do that is we don't target individual birds. I know a lot of folks want to, I want to test this one to see what's going on. When we look at worms, and I know this is a respiratory one, so I'll go be quick, but they're not always, either worms or cocci, right? When those eggs are shed in the droppings, they're not like the same consistency in every dropping. Sometimes we'll have a load in one dropping, and then the next dropping will be completely clean. So the way we do a fecal is to like go on the roosting bar, for example, where there's manure for maybe a couple days, but then to get like a handful of that material that really represents the entire flock, bag that up, bag it again, double bag it. And then ideally in the summertime, we want to send that like 2 day because it can get pretty warm. And by the time it gets to us, it's could be pretty ripe. So get it to us relatively quickly. In the wintertime, it's not as bad. But yeah, we'll do a fecal flotation on that. We can report both coccidiosis or coccidia are in there or worm eggs.
Yeah. Okay, so back to Carol's chicken with the heavy breathing. Should you do anything about this chicken? Should you be worried about her? If that heavy breathing hasn't stopped in 2 months, that's probably something I would go to my vet for, or do, a telehealth meeting with you. What is your suggestions? Or anything to try at home?
So 2 months is a long time. We really want to take a closer look at that. And, I mentioned those air sacs earlier. So deep breathing or heavy breathing, labored breathing in chickens isn't necessarily always a respiratory disease, because those air sacs being in the abdomen, there's other things that can happen in there. So we talk about persistent right oviduct or cystic right oviduct. Any sort of space occupying thing in the abdomen. In this case, it's a cyst, so it's fluid in there. But it's not like it's in the respiratory system, but it's preventing those air sacs from filling up. And so a lot of times, if you ever had water belly in a chicken, you'll notice this deep breathing too. And that's just a result of they can't breathe as deeply. And so they're kind of laboring to breathe. So one thing I would do is go feel her abdomen, and you want to palpate that and make sure it feels like a water balloon. There's probably fluid in there, and we need to, one, figure out what that is and probably drain her to start, and then start to figure out what's going on.
And I know that a lot of people don't know where the abdomen is on the chicken. So if you're holding your chicken and her head's over here, and her tail's over here. It's under the tail, like down underneath between her legs and under tail. People are showing me pictures and they're feeling the front. I'm like, no, that's not her abdomen. Even though ours is in the front, that's not where theirs is.
I kind of describe it like if you hold them like a football, or cradle them in your arm, head kind of tucked into your elbow, right? So the feathers or the tail feathers facing outward. If you kind of pinch, like use your hand, cup again, I'll call it the abdomen, but their belly, right? So what you can usually do is feel the ribs. You feel the back of the ribs, and then work your way backwards towards the chicken, like towards the chicken's vent. All that area, it should be soft and squishy. You shouldn't feel, the only thing you should feel in there mass-wise on the left side, you can kind of feel right where the ribs kind of end and the abdomen starts, there's the gizzard is there. And so you should feel a kind of a golf ball size mass. That's the gizzard, that's totally normal. Everything else should be pretty pliable.
Yeah, and if you're new at that, definitely compare it to a healthy chicken, a chicken that's acting normal and laying normally, and you can kind of feel the difference. And you can definitely tell once you get the hang of it, if your chicken's abdomen is swollen or distended. It's not fun to find that, because you're like, oh man, I got to investigate this one more.
Yeah, absolutely. That's a great. Always pick up your chickens and always kind of be feeling around on them. Knowing what normal is makes knowing what's abnormal very easy to pick up on. So great comment.
Okay, so let's say you go out to your coop, you have a chicken who is showing some, drainage, some discharge, or eyes are bubbly, something's going on. First thing I do is pull them from the flock, because if it's contagious, I don't want 75 chickens getting it. So pull them away. And then what are you doing? What are you giving them to start them off, to give them a boost? What would you do?
Yeah, so again, goes back to the quarantine thing. That's a great idea, right? We want to try to limit exposure. In many of these cases, they actually, and this works for people or anything, we really are shedding, if it's a virus, in a lot of cases, you're shedding virus well before, the most amount of virus you're going to shed is before you actually get sick. So the likelihood of others being exposed is pretty high. That doesn't mean we don't want to quarantine, because we want to, one that allows us to keep a closer eye on them, right? Which is one thing we want to do. We want to watch it to see if it starts to escalate, watch for that labored breathing. If it does, there's one thing, if you're hearing that mucus in the respiratory tract, right, if they're kind of struggling to breathe, one of the things that we can do to help break that up is a little bit of iodine in the water. So totally organic, natural way, or iodine has a bit of a mucolytic effect, so it can help kind of clear up some of that mucus. I'll plug our Breathe products. We've got some essential oil products on there. Breathe is one that has some mucolytic effects as well too, so check that out on the website. But if it becomes severe enough where we're starting to see this move through the flock, one is jump in and let's see what it is. So from a diagnostic standpoint, we want to first figure out what we're dealing with. And then really, if it's severe enough, is to treat empirically. And many of these will respond to antibiotics, not always. And many, even if it's a viral infection like infectious bronchitis or Newcastle disease, while we don't treat the virus, in many of those cases, we can have what we call secondary bacterial infections. So as the bird is, there's more mucus in there and there's that infection from the virus, it causes damage. That respiratory system can't clear itself as well. And then we get bacteria like E. coli that come in and form these secondary bacterial infections. And that can really actually do more damage than the primary issue, right? Than the virus itself. And those infections like that would warrant antibiotics.
Okay, so iodine is a good tip. How much iodine are you putting? Like, let's say you just have a small, just the chick water in with one chicken. How much iodine are you going to put in that? Yeah,
it's not much, a couple drops. What I tell people, you're kind of going for like a stained tea color, like a light tea color. So it's not very much. It's really just enough to, that does a couple things. One, yes, there's a mucolytic effect, but there's also, it's going to sanitize that water. So it kind of prevents the spread of this potential disease through the water. It sanitizes the water. So that's another good approach for it. It works really well for pox too. Pox can spread through the water. And pox can also be a respiratory disease. We didn't really talk about it, but you can have what we call wet pox, right? Where that lesion starts to form in the esophagus or in the trachea, in the mouth. And that's a very severe form of pox. And we really can't do anything about the pox virus. There's no treatment for that, but we can help these birds get through it, right? And try to clear that out.
Yeah, definitely support those chickens through that kind of thing. I forgot to turn my notifications off, and they just keep popping down. My nephew just got his driver's license, I think. So the whole family is coming. Okay, so testing our chickens, and you have supplies for that, so they can meet with you and do, for $9.99 a month. I feel like that's a really good deal to be able to have access to your support, because I feel like there's just not a lot of support out there for people with backyard chickens who view them as, pets and not just disposable livestock. So,
I know. That's what we're trying to do, right? Expand access, let everybody, we're trying to make it at a level where really everybody can have access to it. I know there's emergencies that come up, right? We've got the group page where people come in and try to get help immediately, and we can't always be there to respond immediately, but this is something that one will again allow you to figure out what you can do at home right at that moment, and then if you need to escalate it. So yeah, for sure.
Okay, I think it's Dina. She wants to know, would you give iodine as a preventative? Like, just if you have a healthy flock and you don't want them to get sick?
Yeah, I mean, probably I wouldn't run it all the time. It's not a bad thing, right? So iodine is natural. It's a naturally found in the body. But really I would focus on using it more so when, you see those early minor respiratory issues. It can be a help, an aid there in supplementing what's going on.
So real quick, let's talk about the difference between respiratory infections that they might get, or respiratory distress even from, poor management of manure in the coop, different types of bedding, mold, that kind of stuff, versus viruses that they catch from, outside sources.
Yeah, so, really in backyard flocks, the exposure they have to ammonia is typically low, right? And I'm kind of painting with a broad brush here. Most people are more open air. We don't have the density is not very high, so there's not a bunch of birds in a small space. But if you do have that, right, if it's raining a lot outside and your litter or bedding gets wet, definitely, the combination of droppings and wet bedding can start producing that ammonia. And, if you've ever felt it, if it's severe enough, they can just feel it in your eyes. It's hard to breathe. Obviously, the chickens being on the ground, the ammonia on the ground is going to be much higher than it is where you're standing. So they're being exposed to more. And that ammonia gas, right, it irritates the respiratory tract, it irritates the eyes. And so we really want to do a good job of keeping that bedding dry, keeping the ammonia down, airflow. It's hot, right? So there's more than one reason to keep air moving in the summertime, but keeping our birds cool, which means blowing air, moving air through them, can be really effective at trying to limit some of these particulate things, right? So whether that be dust, or in the case of, there's been a lot of wildfires in the up north and smoke issues. And so
I'll weigh in on that. It really depends on your setup. If you are someone like me who has a roof on their run, it doesn't get wet inside. I have gutter on my run. We have French drains around the outside, and I clean my run a lot. I'll go in there. It's like, this is my hobby. This is my job. I'll go in and clean out my run on a regular basis, remove the droppings from the sand. If you're not that kind of person, if you're getting rain down on your run, sand's not going to work like that. It's not going to work like litter. It's just going to create a mess. So then in that case, wood chips are going to be probably your better option there. So it really depends on your setup that you have. I'm not someone who likes heavy lifting. So if I'm filling my run with wood chips and it was raining on it and it was getting heavy, and it was getting accumulated with droppings and I have to shovel that out, I'm not chicken keeping. It's just not it's just not going to do it.
Yeah. You're right. It's just personal preference, and sometimes the sand is easier to clean up. Some people like sifting through dropping or the bedding, whether it be like hemp bedding or pine shavings, whatever it may be. Those are typically easier to come by. They are lighter too to carry in and out, but again, you got to clean those out as well. So it really is. We'll have. We talked about this before on how to manage heat or in the wintertime, right? So shavings are an insulator, which are great in the wintertime, not so great in the summertime if we're trying to get rid of heat. So a couple different ways to look at it.
Yeah, I'm sorry. I'm at my parents' house, so it's not loud like with my dogs, but my dad's mowing outside the window. Forgot to tell my dad what I was doing. Okay, so is there a way to tell without testing? Is this a husbandry issue, or is it a virus or something that my chickens caught?
Well, no. The short answer is no. I mean, respiratory disease can be a number of different things. We talked about bronchitis in Newcastle and Coryza and LT, right? There's all these various different things. Sometimes the clinical signs point us in one direction or the other. And many times, this test, we don't get the results overnight. So if it is severe enough, we're going to provide some sort of empirical treatment before we get the result back. But once we do get that result, one, we can make you aware of, like if it's Mycoplasma and you're a breeder, for example, we really don't want to be spreading that. So it can be helpful there. But, we talked about this earlier too. Just because you see that snick or that, hear a little bit of noise, it doesn't mean we need to jump to treating right away. but keep a close eye on them. And, if you see that really struggling to breathe, the deep breathing, maybe it's not respiratory disease, right? Maybe it's something else, and we need to palpate that abdomen, see if there's fluid back there. Yeah,
for sure. I always have a lot of people who are like, my chickens, they've got this is a totally different topic. Being egg bound, they feel the heavy abdomen and they're like, they've got to be egg bound. But I find that's not usually the case when that kind of stuff happens. But that was a different episode, so we can table that conversation. There was somebody asking. Okay, is there any other questions in the comments? If you have stuff happen with your chickens, respiratory related. If it's not respiratory related, obviously go check out thepoultrydoc.com and get in touch with them there to get some answers for whatever you're dealing with. We also take suggestions for future episodes. We do this once a month. We come on here live and answer questions about things that you guys are asking about with your chickens that a poultry vet is helpful for. So, let us know, message us, hey, I have an idea for an episode. But if you have any other respiratory questions, you can pop them in the comments before we hop off. Do you have anything else to add?
Well, we really don't vaccinate for respiratory disease a whole lot in backyard poultry, but they do exist, right? So all the various diseases that we talked about, there are vaccinations for them. And two of them, actually one we just started carrying on the site, one of the vaccines, and we mentioned MG, a very severe respiratory disease, and we do have vaccines for that. There are what we call killed vaccines. So when we look at vaccines, we break them into really two categories. One are like attenuated live. So these are either live bacteria or live viruses that they don't really cause disease, but they protect against the disease that they are, right? So we can give those. And then there are the killed vaccines, which are basically we grow that virus or bacteria up and then we inactivate it. And then that's an injection. So we would give that as an IM injection. But there's some really cool new vaccines they've been around for a while, but fowl pox, which many birds get, right? And there's a vaccine for that. It's a wing web stab. It's a little prick that goes through the wing web, very easy to give. There's a new one that protects not only against fowl pox, but also MG. And so while it'll protect against the clinical signs, it'll help the birds get through it. It's not going to be like what we call sterilizing immunity, where the birds can never get mycoplasma, but it will again protect them from those clinical signs. So it's a pox MG combination. There's also a pox LT combination where we can protect birds from LT. So those are two things we can look at. Bronchitis, there's plenty of multiple vaccines for infectious bronchitis. The bad thing about some of these is that they come in doses of like 25,000, right? You get this tiny little bottle and there's 25,000 doses in it, which, the bottle, like per dose it's measured in cents, right? It's not very much. So if we're talking about the cost of what the vaccine is versus the benefit we'll get out of it, if you take your dog to the vet, you're going to pay $50 for that vaccine, right?
Right.
You're going to pay that much for the bottle of 1,000 or 10,000 doses of a poultry vaccine. But look on the website. We've got a ton of vaccines there too for the various bronchitises in Newcastle and MG and MS as well.
Nicole said she had her flock had an upper respiratory infection, and she's noticed they've recovered, but the egg production is lower. Is that to be expected, or is it more related maybe to the heat that's going on right now where she lives?
Yeah, probably a combination of things. When birds have a challenge, respiratory disease or whatever it may be, we certainly will see a drop in egg production, right? You definitely notice it if you've got a bunch of birds, right? Because you can start to see it. If you've got more individuals in the flock, and you kind of notice those differences. But we talked about infectious bronchitis, and we call it a respiratory disease, which is totally true. That virus also affects the reproductive tract. It also affects the kidneys. So that's one thing we can talk about, I didn't mention, but bronchitis can affect the kidneys. So sometimes we'll see looser droppings or just a lot of watery droppings in the summertime. Birds are drinking a lot in the summer too, so don't completely associate watery droppings or just straight water with respiratory disease. You kind of got to take all these things in combination, but the short answer is when we have a respiratory tract infection, many times it will affect the reproductive tract as well too, so it'll slow down with egg production. Maybe you see a lash egg that can kind of, you start fitting the pieces of the puzzle together and can kind of help determine what it is.
Yeah, and there are certain infections that can damage the reproductive tract, right? And you get sometimes you see eggs that are not being laid normally.
Yeah. I mean, it goes back to bronchitis. So that's actually, we'll see, in commercial production, we're looking at 10,000 hens, which is really great because you can see like minor changes, right? And so when we see bronchitis go through a flock of hens, you'll notice rough, misshapen eggs. So really kind of lumpy eggs or misshapen eggs. That's a sign of bronchitis. And actually, there's a lot of data out there to say if birds are affected very young with certain, there's different serotypes. There's different types of infectious bronchitis. Some of them affect the reproductive tract more than others. And they'll actually damage that reproductive tract to the point where they won't lay eggs because it actually turns the reproductive tract into essentially a cyst. It's very, very damaging. Don't see that as much in backyard, but it can certainly happen.
That is good to know. Keep muting myself because my dad is mowing outside this, like he is like right against the window, like Dad.
I noticed this when I'm talking to folks and they're out in the coop and you see the rooster crowing. The phone does an excellent job of you can't hear it. I can't hear your dad mowing. So
oh, you can't? Okay, good. I will stop muting myself then. Yeah, okay. I know you always hear stuff going around you more than other people do when you're on things. Littlefoot keeps message commenting. She lost a chicken. So sorry about that. I'm not seeing like symptoms or anything that we can discuss, but you can message, one of us and we can try to help you see if there's something that's going on in your flock.
One thing we didn't talk about was, and I get comments and questions about it too, is influenza. And so usually the conversation is about high path influenza. We're not seeing a lot of cases of that right now, but we'll have somebody say, chicken passed, or they think they had high path influenza. Probably not. It certainly can happen, right? We find influenza in backyard flocks. Usually the first sign that we see, to be completely honest, with high path avian influenza in flocks is mortality. So hardly any signs of respiratory disease. We just find birds that have succumbed to whatever, we don't know. And then it's not until we start testing those birds later that we find the virus. So if you do have an event where you have multiple birds that pass, very quickly, that's really what we want to do, a deeper dive in that for sure and figure out what's going on. And that's when it's time to submit that bird for either necropsy or take a sample in and inform folks that you could potentially have an event like influenza, because we don't want to pass that to others, right?
Right. If you have flocks in the area around you, they could also become infected quickly too if it's something that's going around in your flock and you're nearby.
Yeah, and proximity to commercial poultry, right? That's another kind of increased level of potential respiratory disease, right? You're close to those flocks. A lot of these are airborne, right? So whether it's little feathers that come through the air, they can travel for miles, to be honest. Even the dust particles that are in the air, they can come into your flock and affect your birds. We've also got, we talked about vectors earlier, whether it be the tools that you're working with or your shoes, but birds, right? Wild birds can come in, they can be at your neighbor's house or be somewhere else, and not that they're particularly carrying, like they actually are affected by it, but they can have that bacteria or that virus just on themselves, and then they go in and they're eating out of the feeder or off the ground where your birds are at, and that's another way that we can introduce those. So limiting any exposure to wild birds, I know it's difficult, right? The backyard setting is pretty tough, but if you've got an enclosed run that's wired in, if you have the ability to keep those wild birds away, that's always great, because not only do they carry respiratory disease, they carry things like mites and other things too. So limiting exposure, best thing you can do. Good biosecurity is the best approach.
For sure. It's hard though when you got a bunch of chickens that want to go out and free range and you feel bad. And
totally. Yeah,
I find myself weighing the pros and cons there.
Right. Balance the pros and cons. And I know we do the same, right? Do we keep them all penned up, right? And then kind of limit their ability to be chickens and run around. It's everybody's individual decision how they want to do that. We let ours run around and do their thing, and we've had good luck. But we also don't have a bunch of people around us, so very few chickens around us.
That's good. Okay, so Sarah asked, we have a lot of dust around here, chickens sneeze on occasion. We did talk about this earlier in the episode, so you can watch it when we post it. She wanted to know if there's a way to tell the difference between just respiratory illness or if it's just because of the air condition. But we did talk about that a little bit. Certainly dust can make your chickens sneeze. So if that's the only thing you're seeing on occasion, I probably wouldn't worry too much about it. Maybe you can say otherwise, but.
Yeah, dust, obviously we want to limit that. A little bit of dust is going to happen, right? We can't avoid that, but really dusty environments that they're in, we would try to want to limit that dust as much as possible. And I saw another comment there about, neck being stretched out.
Yeah.
So we've talked about gapeworm in the past. We talked about worm issues earlier about how to test for them. But gapeworm is not a respiratory disease, but it's a worm that lives in the respiratory tract. So it lives in the trachea. And I'll get a lot of people that'll say, I'm looking in there in the mouth and I can't see the worms. You're not going to see these worms. They're deep enough into the trachea where you will not see them. Sometimes we can do a swab, like a tracheal swab, and actually get them that way and find them there. We can do a fecal and find the eggs in a fecal flotation, although it's not a very good way to find them. What happens is those worms lay eggs in the trachea, and then the bird basically coughs those eggs up, swallows them, and they come out in the droppings, and we find them that way. But gapeworm is not it's not a good one, right? So these worms are living in the trachea. They basically cause a occlusion of the airway, so they're kind of blocking off the airway, and those birds are struggling to breathe. Yeah. One way you can kind of determine gapeworm versus true respiratory tract infection is, we talked about the eyes, right? So I'm always looking at the eyes. I know I hear a lot of people talking about, the wattles or the combs are pale or flopped over. Really, the eyes, if a chicken's not feeling well, you see the eyes start to, they should be bright and round. If you start to see them kind of start to become squinty, or, we talked about the increased amount of tears, for example, or bubble in the eye, that can be a good way to figure out that there's something going on. But if you see normal chicken, bright-eyed, but trying to gasp, trying to breathe, and a lot of head shaking going on, that's typically going to be gapeworm. That's usually, I look for a normal chicken that appears healthy, but is struggling to breathe, and a lot of head shaking. Sometimes they'll be making noise, kind of this coughing noise, and I'm really starting to look for gapeworm at that point. And if I do see that, it's applying a dewormer, right? We want to give an effective treatment for that, and it's going to be at a higher dose too, because gapeworm, like we talked about Safeguard Aquasol, it's labeled for roundworms and cecal worms. It's not labeled for gapeworms because that takes a higher dose in order to clear those out.
Okay. So people could contact you, make an appointment, and find out the dosage.
We don't talk about off-label stuff. We have to follow the rules and the laws. So we keep it on-labeled, how we say it when we're publicly speaking. But come to the site, and if you've got that issue, that's one consultation we can get you fixed up and right dose and treatment.
Yeah, sometimes I notice my chickens will do that if they were out of water before bed. Simple things like that. You're like, oh my gosh, they're all in here, and or maybe they had if I fed them and they didn't go they filled up their crops and they didn't drink, they'll do that next stretch thing to kind of push that stuff around and adjust. So that I'm like, okay, I'm not too worried about that if it's one or two chickens that are doing it, and I know I just fed them and they were gorging themselves. But if you're seeing it with a lot of chickens and you're seeing it repetitively, obviously something to look into.
Totally, yeah. The gapeworm thing, that's a consistent, those gapeworms don't come and go. They're in there and they're struggling to breathe. So you're not going to see that go away. The stretching of the neck, or adjusting the crop, as we say, that's kind of one and done, or you may see it a few times, but then they stop.
Somebody said triangle shaped pupils in the chicken's eye. You were talking about eye. That's not respiratory related?
No, it's not respiratory disease. So Merrick's is one thing that can affect the iris, right? So those cancer cells can invade that iris and cause misshapen irises, pupils, but not respiratory disease.
Yeah. And we did talk about that in a past episode, or, you can message the Poultry Doc on his website and get some answers there. Okay, I'm not seeing any other respiratory questions popping up. And we talked about, I think, everything I wanted to cover. Is there anything else that you wanted to cover there?
Yeah, I think we went through it all. I've been reading through the comments too as they come in. So thanks everybody too for dropping those in. It's always helpful. Yeah. I think we covered everything, just to go back over, go check out the site. The agent is there, so you can work with that and have answers for your flock. But check out the group page, and I want to say thank you to everybody who's brought this together. Rachel and the videos that we post, and Ryan and I, and all the guys I don't do this on my own to bring all this to you. So it's a team effort. And so it's a big thank you that goes out to our team at the Poultry Doc, and then you and your followers as well. Everybody's been great. So I appreciate it. I'm very grateful.
All right. So if you're seeing respiratory illness signs and symptoms, observe, see what you're looking for. I would not trust the forums on Facebook when people are telling you to give your chickens pigeon antibiotics or fish antibiotics. I would steer clear of that. reach out to the Poultry Doc, get your chickens tested if it's something that you're seeing that you think needs dealt with, because
yeah, and totally. What I'll say to that too is, you know, if we are giving our birds antibiotics, I know illegally there's things available. You can go to Amazon and find some of this stuff, unfortunately. And what I've found is, like, in these conversations with folks, is that, you know, it's gotten so severe, they've gone on these sites and tried to buy some of this stuff, and they've tried to treat for themselves, and it's just not responding. And I've seen enough of that now where I'm really concerned that some of these products that are being sold, and I'll say Amazon specifically, that those are fake. Because they're what they should be, should treat the disease that they have, and they are not working. So I would really question some of these products that you find online that, one, shouldn't be sold online.
Right.
So don't just jump to the antibiotics. Like, find treatments that are approved for poultry, and remember that anytime if you are treating, like with an antibiotic, for example, those residues are in the eggs, and we want to. There's a withdrawal time that comes with all antibiotics, and so we want to make sure that we abide by those withdrawal times, and we don't pass residues on to our friends that we're sharing eggs with.
Yeah, just like I would say, just like with your dogs, if your dog had a respiratory infection, you wouldn't buy just random stuff on Amazon and hope that it works. I mean, I wouldn't. Maybe people would, and you know, if you can't see a vet or something, but you know, they deserve good care too. So I like to say they're more than just chickens.
There's a reason. There's a, you know, if you're buying antibiotics, there's a fish on the label or a pigeon on the label. It's probably not for, I know it's not for your chicken, right? So there's things that can't be used in food animals. We have to remember chickens are food animals, and there's laws and stuff that regulate them. So be aware of that and make good decisions.
Yeah. All right. Well, thank you so much for joining us. You guys, Poultry Doc is here for us. He's starting a revolution for backyard chicken keepers with a thing that was lacking for all of us for many, many years. So I thank you for that. And thank you guys for joining us. And we'll see you next month. We always try to do the beginning of the month as close as we can. Today we hit it on target.
Yeah, we missed a few, but yeah, we're back on track. And I think we've got some lined up, but we're always, like you mentioned earlier, looking for great ideas. So yeah, pass that on. And thanks everybody for joining. And we will see you next month. And
all right, we will post this so you guys. Oh, go ahead.
Oh, I just said, hope the kids get better, and everybody, school's about to start, so we get a break here shortly.
Yeah, I'll see if there's any antibiotics on Amazon they can use.
Yeah.
Just kidding. Just kidding. All right, guys, we'll talk to you soon.
Bye.
Bye.